everyone, it's Fred with Nightingale College, and today I'm going to be demonstrating administration of an intradermal injection. The first thing we're going to do is gather our supplies, which are going to be gloves, gauze, 2 alcohol prep pads, 29 or 30 gauge half-inch needle, and a 1 milliliter syringe. Next, we're going to verify the healthcare provider's orders and compare with the MAR. The order reads 0.1 milliliters of tuberculin purified protein derivative. Next, we're going to go ahead and verify the 6 rights of medication administration, which are the right patient, drug, dose, route, time, and documentation. Next, we'll perform the calculations needed, which are 5 tuberculin units per 0.1 milliliters. This is what we have on hand, so we will be administering 0.1 milliliters to the patient. Okay, so next, we're going to gather our supplies and enter the room. Knock on the door, perform hand hygiene. Close the curtain for privacy and introduce yourselves to the patient. Hello, Mr. Victor. My name is Fred. I'm going to be your nurse today. Could you please tell me your name and date of birth? Okay, I'm going to go ahead and look at your wristband, compare that name with the name that we have on the order. Before we continue, is it okay to discuss about your healthcare information in front of your guest? Yes? Okay, great. Victor, do you have any known allergies that you could let me know of, such as allergies to food, medication, or seasonal? No? Okay. Victor, your doctor has ordered a PPT test, and this test is a skin test. The medication used is called tuberculin purified protein derivative. It's the way it works is that it causes a delayed hypersensitivity lymphocyte reaction. So we administer the medication into the dermis of your forearm or a different location, but into your skin, and you should rise up and be elevated for like 6 millimeters to 10 millimeters. After 72 hours, we'll assess the site to see if you are positive or negative. Okay, some common side effects with this medication are itching, bleeding, and swelling. It's completely normal. Some adverse effects would be if you feel shortness of breath or have a rash in any location. Please let us know right away if you experience that. Do you have any questions for me at this moment? No? Okay, great. Okay, Victor, so the first thing we're going to do is wash our hands, put on some clean gloves, and get our syringe. So once again, I'm going to go ahead and compare the medication to the medication on the order. Make sure it has all the name of the patient. So this will be our third verification. So now we got the 29 or 30 gauge half-inch needle. We're going to open the container with the needle facing up. I'm going to pull down to approximately 0.1 milliliters. So pull down to 0.1 milliliters of just air to create that negative pressure inside the vial. Okay, now we place that aside. We're going to get our alcohol prep pad, open it up, pop off the top of the vial, and clean the rubber area. So we're going to let that air dry, dispose of our alcohol prep pad. Okay. Now that that's dry, we're going to go ahead and grab the needle, uncap the needle, placing it over here, and then we're going to go ahead and insert that into the vial. So we insert it, and then we inject the air. Once we've injected it, we're going to go ahead and flip it upside down. And then to prevent any bubbles, we can flick the syringe. And if there's too much air in the syringe, we can reinsert the solution and re-withdraw. the medication. Okay, so now we got 0.1 milliliters. Now that we got that, we're gonna go ahead and use the scooping method to recap this needle. So we scoop, and then we can pull down on this plastic. Now we should have 0.1 milliliters of medication in the needle and syringe. Okay, now that that's good, we're gonna place that aside, and then we're gonna go ahead and choose the side where we'll be injecting. So we can inject on the patient's forearms, or we can inject on the patient's upper back. I'm gonna go ahead and demonstrate as if I'm injecting the patient's forearm. So when choosing the patient's forearm, the first thing you're gonna want to do is go ahead and look at the patient's forearm, assess the patient. So you're gonna go 4 fingers from the antecubital area space. So we're gonna go from 4 fingers and above. So anywhere from here is good, and from up here we're gonna place our hand on the patient's wrist, and anywhere below there is good. So this would be the area we'd be injecting. So here in this case, this is gonna be the patient's forearm, and so the first thing we're going to do is assess the patient's forearm, if there is any lesions, discoloration, or if you're going to palpate the skin for any tenderness. Do you feel any pain or tenderness there? No? Okay, great. Okay, now that that's been assessed, we're going to go ahead and get the alcohol prep pad, new clean alcohol prep pad. Start from the center and work our way out approximately 2 inches. So working our way out. Now dispose of that into the trash. Okay. Now we're going to go ahead, remind the patient, Mr. Victor, upon administration, you're going to feel some stinging and some swelling will occur. Okay, so now we're gonna go ahead, uncap our needle, and we're not gonna touch the site that we just cleaned. With our thumb, we're gonna pull back on the skin. We're gonna pull back on this patient's skin. We're gonna make sure that the bevel is facing up. And then we're gonna go in at a 5 to 15 degree angle. Okay, and then once we feel some resistance, we can go 1/8 of an inch into the epidermis. Okay, and then we're gonna slowly inject the medication. Okay, so I'm seeing what's it called? A 6 millimeter to 10 millimeter bleb is what we're looking for. It should look like a mosquito bite. Okay, and then once you remove the needle, you're going to go ahead and place the gauze on the patient's site. So we got the gauze. We're not making sure we don't put any pressure. So leave it on there. And we're going to dispose this into the sharp spin. Okay, we're going to remove the gauze, and we should see the 6 to 10 millimeter bleb. If the patient's bleeding, we can place a band-aid, and yeah, so that should be it. I'm going to go ahead and remove our medication, remove our trash, dispose everything into the trash. And then we're going to put the patient in a comfortable position, give them their call light, We're gonna go ahead and pull the curtain, the privacy curtain back, and make sure to remind the patient if they feel a fever, if they feel like they have a rash, and please let us know right away, or shortness of breath. Okay, Mr. Victor, if you feel a shortness of breath, a rash, or a fever, please let us know right away so we can help you out. Okay, I'll come back within an hour to check up on you, see how you're doing. Okay. Okay, then I'm going to go ahead, remove my gloves, perform hand hygiene, and document what I performed. Thank you.